Cigarette smoking is decline in the Western world. In 1974, according to the American Lung Association in UK, 51% of men and 41% of women smoked cigarettes, nearly half the adult population. Cigarette smoke contains polycyclic aromatic hydrocarbons and nitrosamine, which are potent carcinogens. It causes release of enzymes from neutrophil granulocytes and macrophages that are capable of destroying elastin and leading to the lung damage. Cigarette smoking is addictive and harmful to health. People usually start smoking in adolescence for psychological reasons. The dangers of cigarette smoking on health are lung cancer, carcinoma of esophagus, ischemic heart disease, peripheral vascular disease, bladder cancer, a decrease in birth weight of infant, an increase in asthma, memory loss, and COPD, chronic obstructive pulmonary disease, which is a topic of discussion today.
Oh, it is a very interesting topic. I would like to join in. Can I please?
Sure, you can join too.
I am so confused. Is COPD a restrictive lung disease or obstructive lung disease?
It's a very good question. So let us understand that what does the destructive lung disease means. People suffering from destructive lung disease have a hard time fully expanding their lungs when they inhale. That is, it's more difficult to fill lungs with air. And why does this happen? This is a result of the lungs being restricted from fully expanding and can occur when the tissue in the chest wall becomes stiffened or due to the weakened muscles or damaged nerves. Any of these factors can restrict the expansion of the lungs, and the examples of the conditions classified as restrictive lung disease include. Okay, so before I disclose the answer, can anybody tell me any of the examples of the restrictive lung diseases? Any of them that you know?
Uh, um, Silicosis and pulmonary fibrosis.
That's absolutely correct. And the other examples include interstitial lung disease, amyotrophic lateral sclerosis, asbestosis, and sarcoidosis. Now let's understand that what does obstructive lung disease means. Obstructive lung disease hinders a person's ability to completely expel air from the lungs comparatively from the restrictive lung disease in which there is difficulty in taking air. And this occurs because of the narrowing of the pulmonary airways comparatively from the restrictive lung disease that occur because of the chest wall becomes stiffened or weakened muscles. Now, what are the examples of the obstructive lung disease? Yes, can anybody tell me?
I have no idea. It is difficult for me.
Never mind. I would like to disclose it. So, the examples are bronchitis, bronchiectasis, cystic fibrosis, and girl, you got your answer here. Chronic obstructive pulmonary disease is an obstructive lung disease. Okay?
Oh, I got it now.
Chronic obstructive pulmonary disease. This is predicted to become the third most common cause of death and fifth most common cause of disability worldwide by 2020. COPD is an overarching diagnosis that brings together a variety of clinical syndromes, which are associated with airflow limitation and destruction of the lung parenchyma. So, can anybody tell me the diseases that are associated with COPD?
Yes, I know. Ischemic heart disease, hypertension, diabetes, heart failure, and cancer.
Yes, these are all the comorbidities which are associated with COPD. That's right. So, my friends, today we will discuss COPD in profound and more engrossed way. We will discuss definition, epidemiology, etiology, pathology, clinical features, investigations, management, and prognosis.